Today I want to highlight an intriguing paper on Mycoplasma genitalium and a possible future treatment strategy that sounds unexpected. Disulfiram, the old drug we know from alcohol aversion therapy. Why is this important? Because Mycoplasma genitalium is becoming a major antimicrobial resistance problem. It can cause urethritis, cervicitis, and pelvic inflammatory disease, and resistance is rising across the few drug classes we usually rely on, including macrolides, fluoroquinolones, and tetracyclines. In some cases, we are now seeing strains with resistance to essentially all standard options. This study looked at disulfiram, or DS, and found that it had potent in vitro activity against M. genitalium, including strains resistant to other antibiotic classes. The minimum inhibitory concentrations were very low, in the range of 0.031 to 0.063 milligrams per liter, which is remarkable. In fact, the authors state that M. genitalium may have the highest reported sensitivity to disulfiram of any bacteria studied so far. But the really interesting part is the mechanism. The antimicrobial effect was copper-dependent. Disulfiram is metabolized into diethyl dithiocarbamate, or DDC, and the data suggests that this compound forms complexes with copper and helps shuttle copper into the bacterium. The authors used radioactive copper-64 and showed that disulfiram and DDC dramatically increased copper uptake by M. genitalium. That supports a kind of Trojan horse model. The drug helps drive toxic copper into the organism. They also showed that this effect could be reversed by a copper chelator, which further strengthens the idea that copper is central to the antimicrobial activity. Interestingly, resistance in mutant strains did not seem to be explained by failure of copper uptake, suggesting that downstream mechanisms may be involved. Now, before anyone gets too excited, this is still an in vitro study. The big clinical question is whether enough active metabolite and enough free copper can actually reach the urinary tract at effective concentrations in patients. The authors are very clear that only future in vivo and clinical studies can answer that. So here is the takeaway. Disulfiram is not ready for routine treatment of Mycoplasma genitalium, but this study opens a very interesting door. In an era of multi-drug-resistant M. genitalium, repurposing an old FDA-approved drug with a novel copper-dependent mechanism could become a valuable strategy worth pursuing.